The next thing will be that she will start menstruating. And this menstruation largely comes as a result of a frustrated egg, which occur as a result of ovulation. So ovulation is actually the release of an egg, and the purpose is for fertilization. If fertilization does not occur, then you have menstruation. Hello everyone, welcome to Check Your Health and Maintain Your Health. Thank you so much for being here. If you're just joining, welcome. If you're clicking here for the very first time, don't forget to subscribe to our channel and continuously follow us as we discuss health related issues. So we'll be looking at symptoms of ovulation versus symptoms of STIs. You know, ovulation, which is release of an egg, has symptoms that will let you know that you are ovulating as a lady. But these symptoms are also related to symptoms of STIs in some situations. That is why we are looking at ovulation symptoms vis-a-vis STI symptoms. STIs here, we are talking about sexually transmittable infections. So please, if you find this video worthy, just help share to someone who also would like to watch it. Thank you very much for being here. The very first symptoms of ovulation we'll look at is headache. Headache, which is a symptom of ovulation, is largely a symptom that does not concern STI, but there are some STI that are also having symptoms similar to headache. You have STIs like hepatitis B. Hepatitis B is a viral infection, but if you have hepatitis B, you also have headache. So which therefore means that you might have headache, and this headache is a continuous headache. Please do not just conclude that it's ovulation. It could be an STI. So you have headache for STI and a headache for ovulation. But remember that the STI we're talking about is hepatitis B in particular. Another symptom of ovulation is heightened sense of smell. This one has nothing to do with anything STI. Another symptom is temperature. There is a general increase in temperature when you are ovulating. There's a general increase in temperature if you are ovulating. So if you have increase in temperature, it means you are likely ovulating. But remember that this increase in temperature for ovulation is also an increase in temperature for a lot of different infections like malaria, like typhoid. But since we are putting our head just for ovulation and STIs, that's why we are not mentioning malaria, typhoid, and the others. Another symptom is dizziness. Dizziness for ovulation. Dizziness is a symptom of ovulation, but we don't also have an STI that has this symptom, which is dizziness. There's breast tenderness for ovulation symptom. There's breast tenderness. Breast tenderness is linked to pregnancy, but it's not linked to an STI. There is increased sex drive. So during that time, you have that urge for you to meet with your partner. This increased sex drive is not also linked to an STI, which therefore means this increased sex drive, it is a symptom specifically for ovulation. So if you're ovulating, you have an increase in sex drive. Another is you might have cramps. So you might have abdominal cramps. Now, abdominal cramps should be taken care of very, very well, because abdominal cramps is related to a lot of different STIs. Abdominal cramps is related to chlamydia. Abdominal cramps is related to gonorrhea. Abdominal cramps is related to syphilis. Abdominal cramps is related to trichomoniasis. abdominal cramp is related to urinary tract infection. Abdominal cramp is related to a lot of different type of infections. So we should take special note if we have abdominal cramps. Before we conclude that this abdominal cramp is directly related to ovulation, we must have taken into consideration other aspects which we might have, which could lead us to an STI. Another symptom of ovulation is bleeding, and this bleeding is spotting. It's not like heavy bleeding, but you have spotting. Spotting is also a symptom of an STI. So if you have bleeding, you have spotting due to ovulation, please, before you conclude that it is ovulation, make sure that you can discredit STIs, because spotting is directly related to an STIs. And we have STIs like chlamydia. Chlamydia also causes spotting. Gonorrhea also causes spotting. And spotting is also related to cervical cancer. So if you have spotting, before you conclude that it is actually ovulation, please make sure that you can discredit the STIs. Which therefore means that check other symptoms of STIs, because you might have spotting and it is related to STIs without you even checking. So check other symptoms of STIs and you conclude that it is not related to STIs. Once you do that, then it is good. We have egg white cervical mucus. The egg white cervical discharge, this is the main symptom of ovulation. If you have it, there is a higher probability. In short, the probability is highest that you are ovulating. And this symptom is not related to any STI, unless it is just normal vaginal discharge that you see and you are thinking, oh, it is ovulation. Please, if you see egg white cervical mucus, it is like the raw egg when you crack and you take the white, you see that it is stretchy. So that is how your discharge looks like. That is the discharge of ovulation. If you have such discharge, then the probability of you ovulating is so high. And we also have abdominal bloating. Abdominal bloating is related to other diseases as well. So want to appreciate you who've watched. Please, if you consider this helpful, please share with someone who could also need it as well. If you're watching our video for the very first time, don't forget to hit on the subscribe button and subscribe. Thank you so much. If you have a question, send a WhatsApp message through 00237 666 Thank you so much. May God bless you. Do have a wonderful time. Thank you.